Unfortunately, over the course of the last 4 to 6 weeks, we have seen a surge of patients. We've seen more positives in our community, and we've seen more patients admitted to the hospital. Back in the spring, we did a lot of preparation for a surge of patients like this. We knew that this could happen. We knew it was going to be complicated. Because of that, we're ready. Our hospital is ready, our offices are ready. So we have prepared and make sure that it's a safe place to receive care. And we've particularly paid attention that we're able to take care of all of the routine care at the same time we're caring for COVID patients. For example, we have special units where COVID patients are housed so that we can isolate them and the staff that care for them and make sure that they're safe. Doing this does have somewhat of an impact on other parts of our hospital, so we're always looking forward, trying to anticipate what may happen during this busy season in the fall with other respiratory illnesses like the flu, and we may need to modify our operations even further should it become busier with more COVID admissions. We've had to make some changes regarding visitation at our facilities. We understand that's very hard for those that are hospitalized and for the families of those that are in the hospital. But it's something that we had to do in order to keep everyone safe. So we're seeing more asymptomatic transmission in the community. And what that means is people who don't have any symptoms, who don't feel ill and think that they're fine, will transmit it to someone else in the community. And that's why it's so important to continue to wear masks and stay distant. Another concern about asymptomatic spread has to do with the individuals that interact with one another. Clearly, parts of our community are at much higher risk to have serious disease from COVID. The majority of people who do get COVID-19 remain mildly symptomatic and have mild illness, and that's very reassuring. However, certain populations are much more high risk. Elderly populations, those that have other medical conditions. It is so important to stay vigilant so that we don't spread this to our communities, our neighbors, and our loved ones. We have to be very careful about large gatherings. It's the holidays that are coming, and traditionally we all want to be with loved ones and gather people together. But this year, people really have to think about that carefully. You need to make sure that we're very careful about that time of year because it's so easy to have someone who you don't know is ill spread the virus unintentionally. We understand this pandemic has been hard on all of us, and people are tired and they are weary of always hearing about COVID and always having to be concerned about COVID. Yet it's very important that we stay vigilant. We need everyone in the community to help us by doing all those simple things: good hand washing, wearing a mask, staying distant. In addition, we're going into flu season, so it becomes especially important this year to get your flu shot. Of course, it won't prevent COVID, but if we can help keep each other safe from the flu, that will be very important. The specifics around this pandemic change daily. We continue to monitor what's happening in our facilities, locally and regionally, in order to make changes we have to keep everyone in the community safe.